Okay, we're about to get started with Crushing Doubts Q&A. I just got to get my Instagram up and running, and we are ready to go. And as always, we'll be talking about mind-body issues and getting some questions and answers going. All right, Instagram, come on, let's get going. All right, welcome to Crushing Doubts Q&A. We've now switched the time. It's going to be every Thursday at 5 p.m. Eastern, 2 p.m. Pacific. We're used to an hour later, so hopefully we won't lose too many viewers in the transition process, but eventually people will catch up and realize what time it is. So here we are, ready to talk about mind-body issues. I want to talk about why I do these Q&As. I suffered from 8 years of chronic everyday back pain. I've also had other symptoms that I've gotten rid of through these methods, but this was the key experience that I had with 8 years of chronic everyday back pain. And I found that doctors couldn't help me. At least that's what they told me. And there was no reason to believe they could. They didn't seem to be suggesting anything that, was of use to me. Physical therapy, acupuncture, all these things that can help lots of people. None of the things were helping me. So I had to figure out how am I going to get better from this? And listen, for most of the 8 years, I didn't think I was going to get better. There was no reason to think that I would get better. And then I discovered the works of Dr. John Sarno. So for many people joining us for this Q&A, they're going to be very familiar with Dr. Sarno as well. He's saved so many people's lives with his books. He had 4 different books that he wrote. And it got me out of the pain. And it was truly mind-blowing when I realized, wow, I had considered at various points, maybe this is coming from some kind of emotional experience. But what I didn't realize is so much of it was due to my thinking. And so what we're here to talk about today is mind-body issues. These are symptoms that come from the mind or brain and become very real in the body. Mind-body issues are things that are real in the mind and in the body. And what ended up happening with my back pain is I kept thinking that I was injured. I mean, it felt like an injury. It felt as physical as anything else had been, and it truly was physical. But what I didn't know is that there were so many things that can go on between the mind and the body where there can be no structural damage, and yet there you are having pain or other symptoms. So head to toe, you can have any symptom from this. I encourage you to get checked out by a doctor if you're not sure. But if you've been checked out by doctors or you're not getting definitive answers, or alternatively, if they're giving you answers that have actually been debunked in their own journals, then we know it's a mind-body issue. What I found along the way is that to get better, I needed to change my mind if I was going to change my body. So to do that, I had to get certain about what was happening. And that meant I had lots of questions to be answered. Even after I read Dr. Sarno, I needed to understand all kinds of things to figure out, well, why do the symptoms behave this way? And why do they come at this time? And why do some people not have them, but I do? I needed to make sense of it all. So this is why I do this Q&A. This is part of what I wish had been there when I was suffering, is somebody to answer mind-body questions, just tons of them. And so that's what I'm here to do. You guys are here to ask the questions. I'm here to give you answers, and they need to be to your full satisfaction. So I want to encourage you. My first answer is just my first answer. It may bring up a follow-up question, or maybe you need to know more. Keep asking your questions, and I will keep working to answer them. All right? Now, I do want to talk a little bit about some of the resources available. Let me actually say hi to a couple people before I do that. Shelby Geyer, good to see you here. Carrie Tischler, thanks for joining us on Instagram. Maria Llewellyn as well. Rudemaster27, Rudy, good to see you. Soaring High, great to see you as well. And Darlene, really good to see you. I've been thinking of you. I've actually changed my group structure. Hopefully that will is something that can work for you to return to quickly, because I know we were working on doubt, and I know you got a lot going on. No pressure, but I'm here. And that's not just for Darlene, but for everybody. Okay. I also wanted to say hi to Hillel, and Susan Sereno says, hi, Dan and Crushing Out family. I almost said community, but she notes we're even closer than that sometimes. It really is a community that helps each other. And I want to say something about these Q&As and really just the way that I run Crushing Doubt as a podcast, in my groups, in anything that I do. One of the things that I'm thinking about is we do not want to inspire doubt in each other, because what ends up happening, even in great mind-body experience, different forums, we find that a lot of times people actually end up inspiring doubt. And sometimes even the best of mind-body practitioners can do it. They can say, oh, I'm 99% sure that you're fine. Well, I don't know about you, but if I'm a big doubter, I might hear you're 1% not sure. So that's the kind of thing that can happen anywhere. In here, when we have people talking about symptoms, we're going to talk about doubts. We're going to talk about things we worry about. We're going to talk about symptoms. But I encourage you all, own it as doubt, not as truth, something you're worried about. And you could even be convinced it's true, but at least recognize if we call it into question, maybe it's not true, then we're looking at doubts. I am noticing my Instagram feed seems to be frozen a bit, at least on my end. I hope it is not on your end. So please do let me know. Okay. Debbie A., thank you for joining us here all the way from England. Hopefully the hour earlier does make a difference for you. Debbie is a group member. She just joined. So let me tell you about my groups, because they're a little bit different than the Q&A in a number of different ways. And one of the biggest ways is the amount of access that you get to me. But another is the capability to have back and forth. When you guys ask questions here, I'm going to answer them as much to the best of my ability to your satisfaction. But in groups, we're on a Zoom call. It's right there. I can ask you questions. You can ask me questions. There's a lot of give and take. Okay, I see I'm not frozen on Instagram for Carrie, and so hopefully not for anybody else. It just looks like it is on my computer. And guess what? That's not the computer that matters. It matters that you can see me. So thank you for letting me know, Carrie. But in the groups, these are Zoom calls, and we record those calls similar to this. And but you can pause the recording if you're talking, and let's say there's something really vulnerable going on and you don't want that recorded. You can pause that. But we can go back and look at those recordings so that you can think about the interaction. And each time I help people think from a columns perspective. That's my system in how to understand mind-body thinking. And so that column system is about feeling, thinking, and your relationship with yourself, which corresponds to these columns: the emotions column, doubt column, and power column. These three columns we can look at based on how symptoms are behaving. We can tell what's going on. And I can give you answers about which column do you need to work in. In the emotions column, we work on bringing down onsets and upticks in symptoms because of unconscious emotion. How do we do it? By gaining awareness. The symptoms actually tell us everything we need to know. I call them like a waking dream. They're telling us everything we need to know about unconscious process. I know how to interpret that, and I can help you figure that out. All right. Now, in addition to that, there's the doubt column. The doubt column isn't about feeling. And it's not about unconscious emotions. It's about thinking. If you are thinking the same things over and over, your body is going to respond the exact same way. The physiology will just be exactly the same. So we have to change that thinking. And you can't fake that. You have to actually think through, why is this different? How can I think about this differently? And then it will change. When I discovered Dr. Sarno, I found out, the things I thought I might have, like a herniated disc, these don't actually correlate to pain. I started to realize, it really is true. I'm actually physically okay, even though it's hurting a lot. And that changed my thinking, and it broke up what I would call seemingly chronic symptoms. Lastly, there are symptom plateaus where you're getting better, but you kind of get stuck. And what that usually denotes is that there's some kind of conflict within the self where you're not at peace with yourself. And this is what I call power. So we can work in any of these three columns. And in these Zoom calls, we talk about it. We help you implement the system. Now, the best introduction to my system is my book. That's available on Amazon. I highly encourage everybody to check it out. It is the most comprehensive resource I could possibly have created for mind-body experience. It tells you all about everything. And so it is a great place to start, including with this Q&A, because it's going to give you the basics of everything. And then we can talk about, where do we go from here? What questions need answers? Shelby Geyer said, amazing book. Thank you, Shelby. I appreciate it. So, let me tell you one last thing about the memberships, then I'm going to dive into questions. We decided to change the membership to be something that more people could access for a number of reasons. But what we decided now is that we're going to have 3 different group sessions every single week. And you can join any of them. You can join all of them for just $100 a month. Very, very affordable. And that's by design. There's a lot of people out there who are suffering, many who can't work or are struggling in certain ways because of the symptoms that they're enduring. And so for $100 a month, you can meet with me 3 times a week. And these meetings can go as long as 2 hours so that we make sure that we get everybody in. And that means you're talking at least 12 hours a month with me, and up to 24 hours. for just $100. So if anybody's interested in that, please check out my website, www.crushingdoubt.com. I can work with you on this. I can help guide you through it. I can help you learn the system. Okay, let's get into some questions. All right. Rudy said pain detective. That's his nickname for me, Rudy. I always appreciate that because I search out what is the root cause of everything. You're a little early today. I was wondering why I missed your other sessions. Okay, so I had been away for 2 weeks. Then I was here last week, and then we're switching this time. One of the reasons I switched this time actually is because the groups, I needed to juggle when I was doing what. So what I decided to do is make the groups accessible to the whole world. On Mondays, it's 1 p.m. Eastern, and that can open the door to lots of different communities, including Europe in the late afternoon. It's from 1 to 3 or so. Tuesdays are going to be 10 a.m. to 12 p.m. Eastern, and that opens the door to actually Australia and places like that. And so, and I've got followings in all these places. I need people to be able to come at different times. And then lastly, Wednesday is at 6 p.m. Eastern. I needed people on the East Coast to be able to come after work. Hopefully some people on the West Coast, because it's from 3 to 5, will also be able to do that. It just opens up different options. So anyways, let me know if you have any questions about that. All right. Soaring High says, can you please discuss neuroplastic loop? Thank you. All right. This is something I've been talking about a lot recently, and I found it very helpful to explain the difference between what I would call like regular mind-body symptoms and a neuroplastic feedback loop. But let's make one thing clear. They are both mind-body symptoms, both of these categories, and I'll explain what they are shortly. And they both follow the same rules. They follow the columns rules. The columns really just describe how human beings work. So the difference is that even though they're both mind-body experiences, a neuroplastic feedback loop requires a bit of a different way of working. It requires different expectations about the work. And it also can be recognized by certain patterns of symptom presentation and also its onset. So let me say this. Most symptoms are not neuroplastic feedback loops, but there also are quite common to have neuroplastic feedback loops. The difference is in neuroplastic feedback loops, there are three parts to how this forms. One, there is a very big emotional trigger right at the start of that symptom. And usually people even know about the emotional event. You know, it's a significant loss or milestone or something that really brings up a lot of emotion, or a significant fight. That often gets paired with an actual physical experience that makes you feel in danger. And so a lot of times it happens with limbs, where people kick something or hit something. Sometimes people get it from waking up from a surgery that they had on a limb, and they're worried about, and there's an actual physical problem that they're working through. But because of the emotional upheaval and that physical event, those things combined lead to the third problem, which is obsessions. We start thinking about the symptoms. And by the way, if you have mind-body symptoms, you could have any one of these. You could have it come up because of a big emotional event. You could have it come up because you had a physical event that inspired some doubt and made you worried. Or you could have obsessions about the thinking. But neuroplastic feedback loops, they not only have all three, they also present different from a symptom standpoint. The symptoms tend to be very high in their levels of severity. They tend to not budge much at all. And I just mean it first. I don't want people to get pessimistic about this. It's just a different way of understanding how we work with this. But they don't budge a lot from like discovering unconscious emotions or even bringing down doubt a little bit. These aren't the things that tend to bring that down. What happens instead is you have to keep working at the doubt in a more consistent way, and it's just a slower process. So it's actually the same thing, but at a very high level of doubt with very inflamed emotions and strong obsessions. It's like you got the triumvirate of the problems. So it's really, it's still just a mind-body experience, but it's happening in extreme form. And then what happens, and this is a big hallmark of neuroplastic feedback loops, is we start to collect symptoms because the central nervous system is involved. In other words, not only did your mind-body system get rocked and you got a mind-body symptom, but your whole process, your whole central nervous system got revved up to a certain point, and it's going to need to take some time to calm down, and it's going to need the right thinking to do that. Whereas in mind-body symptoms, otherwise, you're not into that loop where you're going to be expanding symptoms and just collecting symptoms. I've heard people with neuroplastic feedback loops, which, by the way, I have had one before. It is no fun, but I did get past it. And it happened in one foot, and it tried to spread to the other foot, and it tried to spread to my hands. But because I knew how to fight against doubt, it didn't happen. Okay? So typical mind-body experiences can be caused by feelings, thoughts, or your relationship with yourself. This is also true with neuroplastic feedback loops, but it's very high emotion paired with a physical event, and then the obsessions get going. And typically speaking, the symptoms are more stubborn. It doesn't mean you can't get better. You can. I've gotten better from it. Rita's here with us. She's gotten better. You can do that. So what I find, though, is that the distinction isn't talked about that much in the mind-body community, at least not yet. And hopefully it's starting to get talked about in ways that make sense. Okay, that was my long answer. Let's see if you have follow-up to that, okay? Shelby Geyer says, I know my biggest thing holding me back is doubt in mind-body. I probably have asked this before, but how do I believe? I know crush the doubt, but how? All right. So, actually, then you said in one of the lowest lows because my symptoms are so intense. Oh, she's saying she's in one of the lowest lows. Blurry vision, flashes back, chronically lightheaded and off balance, just doesn't make sense. All right. Now, listen, my first rule of thumb, I mean this as good news, Shelby, but my first rule of thumb is you make sense and your symptoms make sense. If you find yourself saying it doesn't make sense, or it's random, you're already off track. And I don't mean that critically. I want you to back up and say, no. How does this make sense? It does. And in your case, Shelby, it does make sense. You know why? Because when fear goes up, symptoms go up. And I've seen this with you again and again. Your fear, when it's up, your symptoms go up. And by the way, when your symptoms go up, your fear goes up. And then your symptoms go up. And so you get into a negative cycle, which is exactly the opposite of what we're ultimately going to be able to do, which is to get you into a cycle where it's down cycling. I'm calming down and the symptoms are calming down, and that calms me down more. And then the symptoms calm down more. So that's what we need to do. But to do that, you have to believe. Now, here's the question, Shelby. It's not really actually about how to believe. It's about why do you not believe? We need to look at that, because that's what I do when I look at doubt. I help people pull it out of themselves. What are you doubting? So we need to know, what are you doubting? Why do you doubt this is mind-body? And you're going to say things that I've heard you say before, like, oh, I'm worried it's actually MS, which it is not. But we have to get deeper than that, because there's actually a deeper thought about why you really think this. It could be, you know what? I don't trust that anybody can actually catch this, or I don't trust that we can ever know, or I don't trust that because it feels so physical that it could be mind-body. There's all kinds of things that we need to pinpoint. What specifically are you thinking about? And I can come back and say, listen, sure, it feels physical. It is physical. We can counter that. So how? I say the way you do it is you expose the doubts and you chase them off a cliff. You keep showing yourself with good self-talk. This doesn't make sense. No. When you say it just doesn't make sense, that's actually wrong. And I mean that as good news. It does make sense. So we have to ask the question, why are you telling yourself it doesn't make sense? I understand why you could. Not saying I don't get it, but we need to think, why would you say that to yourself when we actually have tons of evidence that it does, including some of the leading experts in the field, including myself, have told you over and over, this is mind-body. It's a guarantee. Now, let's find out more about why you think that. Okay. His Greater Grace, thank you for joining us here. Carrie says that's very generous. I think she was talking about my new groups. And I'm glad it's something that can really work for you all. And I hope you will consider joining. If you do have questions about it, by the way, you can email me, dan@crushingdoubt.com. Shelby says, is that what I'm in, a feedback loop? You are not. Okay, that you are not in a neuroplastic feedback loop. Your symptoms don't behave like that. And I'll tell you one reason why. They actually go up and down quite a bit more than a neuroplastic feedback loop does. When I had my neuroplastic feedback loop, the pain and other symptoms in my foot were pretty much constant. And it sucked. I mean, all symptoms suck, but there was really not a lot of moving back and forth. Shelby, you talk about having, better days and then some bad days and dips. In a neuroplastic feedback loop, one of the reasons it can get so dark is there's not a lot of changes. Not until you've broken doubt for a good length of time. But my rule of thumb, number one thing I can recommend for people with a neuroplastic feedback loop, even though you don't have that, Shelby, is to remember that if you can spend the largest proportion of your time outside of doubt or with doubt lowered as much as you can, you will move faster. You'll move faster towards recovery, and then you'll get there. The more time you spend in doubt, the more you kind of stay in the same place, and even worse, can start picking up symptoms. Okay? Now, Shelby, you do have some of the things that fit with a neuroplastic feedback loop, like you sometimes pick up symptoms, but that can happen with normal mind-body symptoms simply because of doubt. Yours is not behaving like that. I do not think that. We can talk more about it to make sure, but I don't think you have that. All right? All right. Hillel has a question on YouTube. He said, "Hi, Dan. I'm starting EMDR. For anybody who doesn't know, by the way, EMDR is a great trauma-informed therapy. It's involving bilateral stimulation of the brain, and it gets us kind of out of our cerebral cortex and into thinking and intuition and connecting to things that we can't connect with very well otherwise. So Eilette, who is his PT, is wondering whether you think it's worth learning about the physiology of the process beforehand, or if it's better to just go in without studying and simply go through the process. All right, this will not surprise you, I'm sure, Hillel, but my answer to your question is it depends on which thing will raise the doubt. I often say it doesn't matter what you do, it matters what you're thinking while you do it. And so if learning about the physiology of the process beforehand would lower your doubt and make you feel like this is going to be helpful and I'm excited about it, or if it just raises more questions and causes doubt, then I wouldn't do it. So it really depends on, does it raise doubt or not? Now, I will tell you, my instinct, knowing you as I do, is that you can always learn more about the physiology if you need to, but it's probably not the place I would start. Just because I feel like that's kind of coming in from a doubting perspective. It's coming in from, well, wait, what is this? This is some weird thing I need to learn about or something. And it isn't. I would just encourage you, try it out and see how it feels. And then you can assess, do I need to know more about it? I don't know that much about the physiology exactly. What I do understand about it, though, is it frees you up from overthinking. And it allows you to access a kind of more unconscious state of mind while being conscious. And I find that's incredibly helpful, especially from an emotions column perspective when we're trying to discover unconscious emotion. All right. Darlene says, I try not to identify with my medical diagnosis, even though I'm on medication for it. I think it's mind, body, and anxiety too. What do you think? I just don't think it's all medical. But is this just denial? Darlene, here's the first thing that I'm going to say. And again, this is just my first answer and we'll do follow-up as needed. I can guarantee you this is not all medical at all. Almost nothing is. We have a mind and it does affect our body. And even when we have a medical condition, we have effects that takes with our minds. And then those effects channel into the body. Parkinson's is a great example of that. When people have a Parkinson's diagnosis, there can be something that is not purely medical going on, but it is actually medical. And yet, how does that not affect your brain? How does it not affect your mind? And meanwhile, we've got studies that show, like Joe Dispenza's studies, for example, that when they did meditations with Parkinson's patients, they got tremors under control just from meditating. So even with existing medical conditions, mind-body experience can be incredibly powerful in helping people with it. There's a review that somebody left on my Amazon page for my book, and it's a medical doctor, and he said, this is an emerging new medical treatment, which it is. And he was saying, you know what? It isn't just about the fact that we can get rid of symptoms that are mind-body. It's also that we can actually manage some medical conditions with mind-body experience. And that shows you how much overlap there is between these. So one thing I can guarantee you, Darlene, is a huge portion of this is mind body anyway, no matter what. And that's the way I would approach it, is that, we don't know how far you can go in alleviating these symptoms from a mind body perspective, but there's no reason to not think that it could go really far. And that's what I want you to work on. Okay, but do let me know what you think, because as always, I often say this, it doesn't really matter what I think when it comes to you. I mean, I'm lending you good information, hopefully, and hope that it's helpful and feels good. But ultimately, yours is the mind that's going to carry this forward. Okay, Amir, thank you for joining us here, my friend. Good to see you. All right. Rudy says, the thing I'm having is when I'm sleeping in a real deep sleep and I wake up highly agitated, and I don't know why that's been happening. Wears off in time, but it can linger on me for a while. All right, I'm going to talk about this in a particular way, Rudy, and I want you to follow up. But when I'm talking to anybody, try not to think of it as just me talking to them. I'm talking to you all about the columns and how they work and how you can think about how you make sense and your symptoms make sense. So if you're not having this before you go to sleep and then it hits you in your sleep, that is an onset or an uptick. Onsets or upticks are emotions column events. So they're about unconscious emotion, and we have a lot of unconscious emotion when we are asleep. So I would want you thinking about, wait a minute, what's happening here? What is the emotional component that's happening here? And listen, you were asleep, so you may not know. If you were having a dream, though, that can give you some access to it. If you weren't having a dream or can't remember anything, what I would encourage you is to think about the day before. What was happening? Because what ends up happening is that's what happens every night we go to sleep. Our brain chews on whatever was going on. And it can, work through certain problems in the unconscious. It can work through certain emotions. We can experience certain emotions, but they're all going to be related to how the day before relates to our overall psychological lives. So that's where I want you to seek information about it. But what I want to tell you is, you make sense and your symptoms make sense. There's a reason this is happening. And you are chewing on some kind of psychological experience. In my book, I talk about in the emotions column how to look for these kinds of things. What types of things are bothersome, whether it's mortality or job-related things or intense relationships or changing events in your life. There's specific ways you can recognize what is happening. And Rudy, you call me pain detective? We need to do some detective skills here and go after what is the emotion involved. All right? All right, VBNess MB, thank you for joining us on Instagram. I see you've got some questions. I'll get to them in a second, but I'm going to jump over to YouTube questions. Okay, Maria Llewellyn. Dan, do you have any advice on dealing with symptom imperative? So symptom imperative is what Dr. Sarno called it, when a mind-body symptom that you get rid of one and it like goes to another. It just keeps dancing to different symptoms. My symptoms keep moving around and new ones appear all the time. This constant shifting creates fear and confusion for me. How can I stay calm and not get caught up in the fear when new sensations show up? Okay, I have a couple things to say, Maria. The first thing is, from a columns perspective, the fact that your symptoms are shifting around from a doubt perspective specifically is good news. In the doubt column is used to get symptoms shifting. If you're kind of stuck in a symptom and it's not moving anywhere, it's because doubt is there. But once you remove the doubt, then the symptoms start to shift. So that's actually a step forward. But I understand you could be afraid of that, and it could bring up other feelings where, oh, now I got to deal with this symptom and I'm worried about this, and will it ever end? So I think one of the ways to stay calm is to recognize that when you're in a state where symptoms are shifting, is very similar to what I just said to Rudy. You're in an emotions column kind of experience. We need to find out, what are the emotions. All of these shifts aren't random. And they aren't about you having, of course, a medical issue or a structural issue. This is still mind-body. But what I want you to do is push back against the doubt and know that all of these symptoms are really just doing the same thing. And because they're shifting, they're related to emotional experience. Sometimes they could be related to what I call doubt triggers, where the symptom imperative could go to a place that makes plausible sense. Let's say you're eating some food and you had a headache, but then suddenly you get tooth pain because you were biting something. Okay, well, Doubt triggers could make the symptoms shift there temporarily. But if it's shifting all the time, then what's happening is either you're having doubt triggers all over the place, or there is emotional life that is driving this. And to me, people are much calmer when things make sense. So I would use the emotions column, Maria. And by the way, if you're not sure how to do it, this is a way that you can do it. Just come to groups with me. It doesn't even take that long. And we'll get some time to crank this out and help you understand, what are you looking for? Why does this happen? How does it go this way? And what are those feelings? All right, Maria, that's my first answer, but let's go from there. All right. Soaring High says, how do you then distinguish if you are in a neuroplastic feedback loop or just your body's structures breaking down? All right. Well, first thing I'll say is this. The body structures don't break down very much in any kind of meaningful way for symptoms. Body structures break down all the time. If you do an MRI of a baby, it looks pretty good. If you do an MRI of a 35-year-old, it looks like a train wreck almost all the time. So first thing I would say is we have to challenge the notion that these structures breaking down is the cause of things. There are hundreds and even thousands of studies that show that all of these structures that we think are causing the pain and the suffering aren't. They're not. They started studying athletes who weren't having symptoms, asymptomatic athletes, and they had tears in their dominant throwing arms. They had cartilage damage. They had herniated discs. They had torn rotator cuffs, and they weren't having any pain or any dysfunction. So first of all, let's distinguish between the fact that structures breaking down really isn't likely to be the problem anyway. But the other thing is, when structures break down, they don't behave like a neuroplastic feedback loop. The symptoms in a neuroplastic feedback loop are much higher than any structural thing. When you break a bone, it heals. When you tear a rotator cuff, as an example, it doesn't hurt as much as a broken bone, and it doesn't stay hurting that much. If the severity is super, super high and it's not budging, that sounds more like a neuroplastic feedback loop. But I also want to encourage you, that could just be doubt raging. So you want to see, did this start around a difficult emotional event? All right, let's do some follow-up as needed on that, okay? All right, Susan Sereno, good to see you here, Susan. Susan says, Dan, I believe my self-criticism and lack of self-compassion fuel my symptoms. I think you're right, especially the nighttime symptoms. Is this possible? What column do I need to work on? Not only is it possible, it's exactly right. I mean, we've talked about how your nighttime symptoms, similar to what I was saying to Rudy, they are emotions column driven. All right. So I see actually Rudy said that makes perfect sense about what I just said. And he said, thanks, Dan. And you're right about the emotions before I go to sleep. Okay. So Susan, it's the same thing. We need to get really used to studying the emotional life. I have this rule about the columns and the flow of the columns. Bring down doubt, learn about emotions, everything flows towards power. Susan, we've brought down doubt enough that we can do this emotional work. There are times where doubt tries to pull you back. But the reality is, if we keep it from pulling you back, then we can discover what's underneath. One of the reasons getting doubt low is so important is then things start to shift, and then we can see what is happening when. And that connects us to the emotional experience. If it's not shifting at all, you can't see it. So that's why we got to get doubt lower. All right. Now, it's, as I said, it's not only is it possible, it's exactly what needs to happen. And what column do I need to work on? The emotions column. No big surprise there based on what we've been saying in group. Okay. So let's keep working on that and go from there. Okay. Mike, is this Mike Webster? I think it is. All right. Hi, Dan. If a symptom is there and is seemingly chronic, and if someone does not believe they have any doubts, is it possible that it is a power column symptom, or is it a rule that if something is consistently acute, that's the word that I use for seemingly chronic, because it's always there, but it could be made to go away at any second. Let me go back to this. Is it possible that it is a power column symptom, or is it a rule that if something is consistently acute and that it seems like it isn't breaking up with doubt work, there must be some underlying doubt remaining? Okay, that's an interesting question for multiple reasons, but what I would say is this. If there's very high-level symptoms that aren't breaking up, that sounds like doubt. If there's sometimes even just mid-range symptoms, but certainly low-level symptoms that are just hanging around, those could be power column related, because that's another reason that things get stuck at a certain point, but they usually get stuck at a lower level. So some of what you're going to need to determine is the severity of those symptoms. The other thing is, if you feel your doubt is low and it's not moving around, that's another sign that it is likely to be power. Now, doubt does sneak through sometimes, often actually. It can fool you into thinking, oh, I thought I didn't have any doubt, but I did. So I would certainly look there. But if the symptoms aren't really severe and they're just kind of hanging around, I would look in power. All right, let's have a follow-up, Mike, as need be. Okay. All right. All right. Shelby Geyer says, I think I don't believe because the symptoms are so freaking intense at times, and I don't hear people have these symptoms exactly. Okay, so first thing I want to say this is the more intense the symptoms, the more likely it is to be mind-body. The worst symptoms I've ever had, by far, hands down, were all mind-body. Every single one of them. I've broken bones. I've had pneumonia. I've had all kinds of things. And the worst symptoms I ever had are almost always mind-body. So we have to learn to not distinguish between severity and mind-body or not. They actually usually go hand in hand. So that's one thing. Now, I don't hear people have these symptoms exactly. If you talk to anybody about their symptoms, they're not going to sound exactly the same. I could describe my back pain and it would not sound exactly the same as any other back sufferer. We all have very unique symptoms. Why is that? Because these are mind-body symptoms. Our body is expressing our minds. And think about how varied our minds are. There's no way we're going to have the same symptoms. The way that I think about it is, and hopefully I can get you to believe this, Shelby, but head to toe, every single system in the body, everything the body can already do, the mind can use it for mind-body purposes. It doesn't matter what your symptoms are. Once you've been cleared by doctors that there's nothing clearly medical going on that they know about, then you're in the clear and you can start to think of everything as related to mind-body. All right. VBNess MB, thank you for joining us here again. You said, mine are constant in my eyes, full body, and although improved, I'm developing more and very visible. Told MCAs, is this mind body? Hold on one second. Do you think I could switch on mindset of living normally despite stinging all over, and in time it will pass? Okay, interesting. Yes, I do think you could do that. You could switch your mindset, but I think you could actually do much better than that. My feeling about this is you're having doubt. No big surprise there coming from me saying you're having doubt. But the reality is that's where most people start. There's a reason this is called crushing doubt, even though there are 3 different columns. Doubt is the linchpin of everything. You've got to get there first. When in doubt, work in doubt. So you say you're improved, but you're developing more and more very visible symptoms. And so we need to think about what that means and what you end up thinking, because the doubt will drive things. So for some people, living normally despite the stinging and knowing it'll pass in time, that settles them down enough to just not worry about it. If that works for you, then do it. But if that doesn't work enough, then we need to do exactly what I did with Shelby and say, wait a minute, what is the nature of why you're thinking these things? And we can actually tackle the doubt itself. All right. Now, I can guarantee you can get this to change. Every mind-body symptom is resolvable, every single one, and the columns show us where to work when. One of the things I love about the columns is that it's a system that doesn't just say, just do this or just do that. And all of these things in the mind-body field, they can be helpful. Journaling, not paying attention to the symptoms, somatic tracking. There's all kinds of things that can help. But really what you need to know is when. When do you do what? And the columns gives you a system that can shift. We're going to do this at this time and this at this time because of this and this. And we're going to learn how to figure out when to do what. It's a huge part of what I do in groups is help people implement when to do what. But either way, you can definitely get out of this. Okay, Shelby Geyer had a follow-up. I guess, too, it's the up and down that seems like in a cycle. Kids get out of school and for a few weeks felt almost normal and then down again and taking longer to feel better or budge symptoms. We've got to get you onto the idea, Shelby, that you make sense and your symptoms make sense. Every time doubt convinces you it's just random, there's nothing you can do about it, or maybe it's not even mind-body, then you're off the track. And I don't mean that critically. I actually mean it as good news that if we keep pushing in this way, we can get you to a point where you can decide, I'm not going to listen to doubt anymore. You can stop this cycle, because the cycle is about whether you're believing doubt more than anything else. You could say, no, I've got the best medical doctors in the world have cleared me of this. I've got people like Dan telling me, and who know all about this, that this is mind body and that I can get better. And I need to start thinking about it that way. And that could then get you into some mindset of, you make sense and your symptoms make sense. Okay. Darlene says, thank you. That makes sense. I will email you about groups. Sounds good. I'd love to help you. And hopefully that cost effectiveness makes it easier. There are so many healing anomalies, not only Joe Dispenza. So I know there is something I can do regarding mind body to improve and heal. Absolutely. Those anomalies, sometimes people are like, well, that's the exception to the rule. No, actually it isn't. The fact that there is an exception to the rule means something's going on there. We're not able to make something happen that is not possible to have happen. So the fact that these seeming anomalies or unusual experiences happen, they tell us there's something else there. Thanks for voicing that, Darlene. Okay, so Soaring High says, if it didn't start during any emotional event, can any chronic pain be not mind-body? No, actually, I have found that anything chronic is mind-body. The only chronic things that really exist are things related to tissues that don't heal, like internal organs. For instance, my wife is a type 1 diabetic. Her pancreas does not produce insulin. That's chronic. Hopefully they're going to solve that at some point and cure diabetes. That would be amazing. But in the meantime, pain, never chronic, ever. What can happen with that, though, is that if people don't know that, it can just go on and on and on. It can go on for decades if you don't know these answers. But if you do know these answers, it makes all the difference. Okay, Soaring High then says, is increase in pain with physical activity always a conditioned response? In mind body symptoms, yes. Yes, absolutely. I want to encourage you all. Our bodies are made to do the things they're supposed to do. We're completely able to do these things. We're not going to run into situations where we hope we can do something and it turns out our bodies are saying, no, you can't do that. That's not the way it works, because it's been millions of years of evolution. Our bodies are made to do these things. They're not made to have these problems. What ends up happening, though, is that the more time we have on our hands to think and worry, the more mind-body processes can take over. That's why they're actually more prevalent now than ever before. In addition, there's another reason. A lot of the psychological defenses have been dismantled by psychology. People know what denial is. They ask questions about it. Darlene made reference to it directly because we all know what that is. But most people in the world don't know about mind-body issues and how that is a psychological defense. And that is why it is the number one most used psychological defense in the world. And I'm a psychologist. I can tell you what's out there. It is the most used defense. So we need to get really aware of that, because otherwise chronic pain can endure. And I know I don't even use the word chronic, though. I use seemingly chronic because I want to show it's actually consistently acute. Consistent, always there. Acute could always be made to go right then. Positively Whitney, thank you for joining us here. Casman Thibault, good to see you as well. And East Coast Angling, thank you for joining us as well. Okay, Shelby Geyer then says, I guess I just hate when people say once you're cleared by a doctor. Well, I was a few years ago, but that's all old news and more symptoms. So then what? Oh, I have a great answer for you, Shelby, at least as far as I'm concerned. If you were cleared by a doctor a few years ago while having these symptoms, and now you're saying, well, but maybe these symptoms aren't because of that same thing. Maybe I have a medical condition now. Think about how, this is good news. Think about how illogical that actually is. I say this not anything against Shelby's doubt, because this is how doubt works for everybody. We all say things that if you really look at them are ridiculous. Doubt is saying ridiculous things. Imagine that you were cleared by doctors but had these symptoms, and then 3 years later you now have these symptoms for purely physical reasons and not mind-body reasons. It makes no sense. The symptoms are going to be for the same reason they were before. So if you were cleared by a doctor years ago, you're done. You don't need to anymore. And meanwhile, I often don't even need people to get cleared by doctors for some things because I'm so familiar with what they are, like back pain, for example. The only thing I'd need people to get checked out for is like, well, we got to make sure there's nothing life-threatening. Is there like a tumor in there or something? That's why I want people to go to doctors. Doctors are very important and they're very good at that. And mind-body doctors are even better than that. They can help you understand what's what. So you've not only been cleared by doctors, you've been cleared by some of the best mind-body doctors. Now, I understand that's hard to take in and accept sometimes, but you're totally safe, whether you're worried or not. All right. You said to Soaring High, chronic pain is always mind-body. What about chronic physical symptoms? Unless it's related directly to an internal organ being damaged, then there's nothing chronic. Nothing at all. VB Ness says, is visible swelling all over mind-body? Yes. Yes. Nothing makes somebody swell all over, except for mind-body issues. If you think about it, anything that's systemically everywhere, it's got to be the brain. There's nothing else that can make that happen. Shelby says, LOL, I know I'm ridiculous. Thanks, Dan. Happy 4th, Dan and all. All right, Shelby. Well, we're all ridiculous at times. That's what doubt is about, but I'm glad we're exposing it. All right, a couple last questions. We'll wrap up here. Susan Sereno says, I think I'm afraid to get to the subconscious emotions. Bingo. Yes, you are. Is that possibly why I'm having difficulty getting better? Yes, yes, yes. She says, I am better, but not completely. Stiffness and nerve sensations is mind-body, correct? Yes, absolutely. I find it interesting. A lot of times people say, oh, I wake up so stiff. And then other people are like, oh, yeah, well, I was lying there. I was more relaxed than ever before. Both things can't be true at the same time, really. Your stiffness is about whether you're tense. You can be lying there and totally relaxed, or you can be lying there totally stiff. But jumping back to what you said before, yes, we're working on getting at the emotions problem there. Okay. Debbie A then says, after having a run of wins, leaving the power column group this week has caused fear, doubt about me being able to manage my symptoms. Yesterday and today, my anxiety has ramped up. Okay. One thing, Debbie, you've now joined the regular groups. That's going to help you quite a bit because you're going to see you're still connected with me. We can still work on power there. It's all good. And worst case scenario, if you feel the power column group was such a helpful thing, and I'll get to what that is in a second for everybody, then we'll talk about it. You don't have to lose anything. Let's work on it together. The power column group, by the way, I have 2 groups they're capped groups where only so many people can do it. And they are higher fees because of it. But if that's something that you're interested in, to make sure that you have that time with me, the power column group is a capped group that works specifically on power. And people have to have their doubt low enough before they come there. All right. Nox Flamma, thanks for joining us here. You just did the tail end here because we've adjusted to 5 p.m. Eastern instead of 6 p.m. Eastern. Just note that for next week, and hopefully we'll be able to catch up more. All right. Soaring High says, can it take years for symptoms to go away? And do you need to do journaling and et cetera? Meaning how to know what exercises to do. Okay. So can it take years for symptoms to go away? Only in extreme neuroplastic feedback loop situations do symptoms tend to take a year or sometimes more, but you still should see a lot of progress during that time. So typically speaking, a couple months is generally the maximum amount of time before I tend to feel like things start to shift at least some. So shouldn't take years overall. You should get a lot of relief. And almost all mind-body symptoms that aren't neuroplastic feedback loops, they get cranked out much faster than years. Sometimes they're days. My record is I cured one woman of 9 years of heartburn in one session. That can happen with mind-body issues when you really nail it. Okay. But you said, do you need to do journaling? You don't need to do any one thing. You need to do the things that bring down doubt and get you the emotional awareness and make you feel aligned with yourself. Those 3 things. Sometimes that'll work where journaling does that. Sometimes that actually just feels like beating your head against the emotional brick wall, as I say. So determine what works for you. Are problems walking on the left side, sort of having gait problems, also mind-body? Very easily mind-body, yes. Now, it can be for other reasons, but the vast majority of the time, it's going to be mind-body. There's an expression that when you hear hooves, think horses, not zebras. It means, typically speaking, if you hear hooves, it's likely to be a horse, not likely to be a zebra. We don't see a lot of those. Mind-body experience is the horse. It is the usual one. All right. VB Ness says, if this was triggered by medication, is it still emotional 3 years symptoms? I actually think that's likely to be doubt, because the medication made you think something happened, and then you're off and running, and you need to be able to break that cycle by knowing that you're fine. The medication wouldn't be affecting you 3 years later, though. No way. It gets out of your system much, much faster than that, probably in a matter of days. But it can trigger things, especially when people get worried. So if fear goes up, it can lead to these symptoms. This sounds like fear, by the way. That is the emotional form of doubt. There are 4 forms of doubt: fear, confusion, lack of certainty, and unanswered questions. VBNS, this sounds like you are dealing with doubt. And we can work on that. If you want to email me, dan@crushingdoubt.com. Is there a recording of this? Yes, there is. I will put the recording, the Instagram recording, out right after the show. The YouTube one goes straight to YouTube. All right. Let's see. VBNS said, told medication pushed on for 9 weeks, triggered MCAs. Actually, I was thinking about the abbreviation MCAs. Can you tell me what that is? I apologize if I'm being dense, and I maybe should know it, but I often don't even think in terms of acronyms or diagnoses and things like that. So just let me know what I'm missing there. All right. We're going to take 1 or 2 last questions. Sally Field Leal says, wondering about neuropathy in hands and feet. I had a doctor clear me last year. Thank you. I have cured people of neuropathy in hands and feet. I have on my podcast, there's a guy, Ron, who I saw for a while. He had neuropathy in hands and feet. Totally clear now. Okay. Weakness where I had replacement, is that mind body? Yes. People can have experiences of weakness because that's their expectation. And sometimes they can even translate to actual physical weakness because the muscles aren't contracting as strongly or responding as strongly because of the fear. Knox Flama said, you said bring down doubt, get emotional awareness and align with yourself. Emotional awareness was the missing part there. Okay, a mast cell activation. Is mast cell activation mind body, I guess. So, all right, sometimes there's a term where I'm like, you know what, I want to check with a mind body doctor to be sure, but I will tell you this. I've seen this over and over in virtually everything that I hear. The patterns are all the same. Mast cell activation to me sounds like another one of these garbage diagnoses that people give that explains something that's happening in the body, but they don't explain the cause. And the cause is mind body. So we keep labeling these things that are happening as the cause when really they're just another symptom. Whatever mast cell activation is, that's likely to be a mind body symptom. Here, I'll even look it up. What does it say? Mast cell activation. Now, of course, you can't trust everything you read on the internet, but mast cell activation occurs when these immune cells release chemical mediators like histamine. Okay. Histamine response I've seen over and over again. Okay, listen, there's a lot of activity that can happen in the body, including some autoimmune stuff. And the fact is, these are just all, it's actually what Rita's saying. It's a BS label. There's all these labels that people will give, and they're giving it to try to explain something they don't understand. But we in the mind-body field do understand. We know exactly what this is. And meanwhile, they're labeling it. It would be like a 4-year-old being like, oh, you have excessive blueness disease. It's almost just like they're making it up. And I don't mean to come across as if I'm making fun of them, but in a way I mean to, because I want to say we need to stop labeling these things. Rita said, my dad was an allergist for 40 years and never heard of it. It's just a new label to try to describe what they don't understand. Okay, Knox Flama says, thanks, Dan. That really clicks. Glad to hear it. Ann Whitaker Butts, thanks for joining us here. You're just coming in at the end this time, but these Q&As are going to be at 5 p.m. Eastern, 2 p.m. Pacific from now on. And VB Ness, you said, please, can you say how I could consult with you? Email me, dan@crushingdoubt.com. That's one way. You can also go to my website, www.crushingdoubt.com. It's got all the links. If you wanted to join my groups, you could come and see me on Monday. The groups are Monday, Tuesday, and Wednesday, and then I've got those capped groups as well. So there's lots of ways to see me. I do private consultations. They are, I don't have as much availability, and they're much higher fees. So there are ways to go, though, that you can get what you need. And a lot of times, even those are worth it because you can just get so many questions answered in one sitting. So I'm happy to help you all with whatever. Please keep up the good work asking your questions. Oh, I'm going to take one more. Carrie Tischler said, why do we flare? As in go higher than our daily baseline and then go down again. To me, that would be an emotions column symptom, or your fear went up, your doubt went up. So if something happens that gets you worried, you could go up. Alternatively, and this is usually what's happening when there's no doubt that would go up for any particular reason, it's emotional. And a lot of times we just don't know it. We think we're fine, and our body tells us we're not. I tell everybody, take your body at its word. Trust your body over your mind. It will tell you everything you need to know. Rudy says, you the man, Dan. I appreciate it, Rudy. Great being here with you all, and I look forward to continuing. I'll be here next week. Okay, thanks, guys. Take care till then.